Premier Wheatley, with your permission, I would like to adopt the precedents already established, but to give special welcome to the Ministers of Health, Sir Molwyn, for his sterling efforts on behalf of the OECS, and to our incoming chair, as well as to welcome our development partners, many of whom have already arrived. We are delighted to be in the Virgin Islands for two important back-to-back meetings, as you've heard, policy meetings, the Pharmaceutical Procurement Service Board and the Council of Ministers of Health. The hosting of these meetings in the BVI is important for several reasons. The first reason is the transfer of the dual chair of the Council of Ministers of Health and the PPS Board from the Honourable Sir Molwyn Joseph to the BVI Minister of Health, the Honourable Vincent Wheatley. The second reason is that our presence here sends a clear public signal that associate membership in the OECS matters. While the revised Treaty of Basel makes a distinction between protocol members and associate members, the core impulse of the treaty is the cultivation of solidarity and the framing of common purpose. Ultimately, our effort at regional integration should lead to the association of the Eastern Caribbean as a family, pooling our strengths, facing challenges together, leaving no one behind. And the third reason is that the rotation of these meetings provides an opportunity to sensitize the public of our work in the vital areas about things that are making a difference in their lives. Health, as you've heard from both outgoing and incoming chair, matters. Health matters. And it matters to everyone, and the experience of the pandemic has punctuated its centrality to public well-being. The OECS Commission is adopting a new approach to these high-level meetings that is aimed at deepening the engagement of key constituencies in every sector relevant to the specific portfolio. So, for example, our council and governance meetings are not only attended by ministers and their chief technical advisors, but also include our development partners, other regional counterpart agencies, private sector and/or bona fide civic organizations active in that sector. This community of interest does not only attend opening ceremonies, but participates substantially in the meetings, except, of course, for the political caucus, which is for ministers only. And it is amazing how the quality of a meeting is enriched by the inclusion of these voices. At a recent meeting of our Council of Ministers of Education, for example, our council chair, the Honourable Darrell Matthew of Antigua and Barbuda, invited the president and vice presidents of secondary and post-secondary education institutions to attend the entire meeting as observers, again, except for the political caucus. At some point, he invited the student representatives to comment on some of the agenda items. Once they got past the initial shyness, their comments were amazing. The student voice was decisive, it was bold, it was frank, and added much value to the outcomes of the meeting. That same approach was adopted at meetings of the Council of Ministers of Agriculture, with the inclusion of strategic partners and, importantly, farmers' groups. The incorporation of essential stakeholders enriches the decision-making process, ensuring that their concerns, their lived experiences and aspirations are factored into the solutions that we design. In fact, our first experience of that was interesting. Those of you who've been to St. Vincent and the Grenadines know the NIS building is a circular amphitheater. So the actual center of the meeting is the inner circle, and the spectators are on the outer ring. So imagine having a meeting of ministers of agriculture, and all of the farmers' groups in St. Vincent and the Grenadines were represented, and they sat throughout the entire meeting. You know the pressure that put on ministers to be correct and be sensible in their discussions, because the constituents are watching and evaluating what is being said. But more importantly, providing opportunity for feedback from that kind of audience in the course of a meeting certainly helps to democratize these sessions. Our meetings this week cover two highly consequential areas of cooperation that are integral to the revised Treaty of Basel, which is our guiding charter: health and pool procurement. This is the 36th meeting of the PPS board, which means that 36 years of savings in the procurement of medicines and medical supplies. This is a real, although unsung, success story. I've asked the PPS team to pull the historical record so that the full story can be told. But a partial, and I emphasize a partial view of this success was pulled from our electronic transaction platform that was put in place only 14 of those years ago. And in this 14-year period alone, transactions in pharmaceutical purchases amounted to 381 million EC dollars. Based on this record, we can estimate that in the 36-year existence of this facility, transactions could easily have reached $500 million EC dollars. And the PPS achieved an average saving of 20% on medicines and medical supplies. The Chinese say, and I quote, "Opportunity is crisis riding a dangerous wind." Opportunity is crisis riding a dangerous wind. And nothing tests one's mettle more than a catastrophe. And in the past decade, we have rode the dangerous winds of pandemic, disaster, volcanic eruption, and have saddled the dragons. The COVID pandemic proved the value of pool purchasing of pharmaceuticals. The PPS recorded a 59% increase in medical procurement of largely personal protective equipment and supplies during that period. It is important to note that this does not include the procurement of vaccines, which was largely secured through grant support from sources recognized by the World Health Organization. I must place once again our deep appreciation and special recognition to the Government of India for its generous and speedy support to the OECS through the instrumentality of Prime Minister Skerrit of Dominica in securing the AstraZeneca vaccines that enabled us to contain the spread. Besides the savings that are gained from pool purchases, there's also a multiplier effect that can be achieved using what is called a reverse auction bidding method. So, for example, we received a grant of $300,000 from the Global Partnership for Education, which is the largest body disbursing support to education. I have the honor of representing Latin America and the Caribbean on the GPE board, and last year we disbursed $11 billion to countries, developing countries worldwide. Now, with this grant, we went into a reverse auction, which is an auction in which the buyer puts up a request for a required good or service according to certain specifications. In this case, it was for digital devices for continuation of learning under COVID. So we described the specifications we needed for those devices. And we had a total sum of $300,000 to buy. Sellers then place bids for the amount that they are willing to be paid for the good or service, with the winner being the seller prepared to accept the lowest amount. As a result of this approach, we were able to purchase twice the number of learning devices for distribution to OECS member states. And this is the arsenal of methods that we have at our disposal, and why it is not just a matter of pooling of resources, but using creative approaches to optimize the benefits to member states. So where are we going? I have shared this information so that the OECS public can understand the power of collaboration and joint effort. We are transitioning the PPS from being a pool procurement service for medicines and medical supplies to being a pool procurement for anything that member states need to purchase that can be more that can be done more cheaply together rather than separately. For example, after Hurricane Maria, we assisted the government of Dominica in purchasing building supplies for the reconstruction of the island. Now, this did not leave out the private sector, the traditional suppliers. All that happened was an aggregation of the total demand for concrete, steel, galvanized, etc., and looking for you getting the best price possible for that aggregate amount. That material was then given to the traditional private sector distributors with an agreed markup. So it was a situation where everyone won because the suppliers were not cut out of the market. The public received essential supplies for the reconstruction of their homes at prices that were cheaper than ever before in a time of crisis when price gouging becomes the order of the day. In this vision, the private sector can also benefit from pool procurement in some essential goods and services, example, school supplies, textbooks, and disaster relief material, whose distribution can be efficiently executed by the private sector in a win-win proposition for all. Following the PPS board will be the 9th meeting of the Council of Ministers, as you've heard, and this council is one of the governance structures that has had the most consequential impact on the widest demographic of people of the OECS. As an institution dedicated to serving the people of the region, we cannot seriously address the challenge of harmonization of structures, convergence of direction, and deepening functional cooperation if our work is only executed through projects. Serious development work requires the cultivation of capacity and the construction of sustainable structures that can make tangible things happen. So the story of the health unit at the OECS illustrates why regional institutions must think ahead and be able to anticipate the challenges that are lurking around the corner. Our first attempt to establish a health unit was not successful. I unfortunately led the case to the heads. It was not successful because there was a view at high levels that the Commission should avoid becoming a bloated bureaucracy. And there was good reason for this if we look at the inefficiencies of some of our public sector institutions. It took Sir Molwyn Joseph, as our lead Minister of Health, to successfully make the same case to the succeeding meeting of the authority, because he was able to articulate the grave lurking dangers in public health. And I want to publicly thank Sir Molwyn for taking us here today. Since the establishment of that unit, every major health crisis has been anticipated by the OECS, and adequate proactive preparation has been made in close collaboration with member states to safeguard public health. In every instance of the threat of pandemic, our ministers of health and the health unit have been proactive with scenario planning and anticipatory positioning. So when Ebola emerged, you recall Ebola emerged in Africa, we made immediate arrangements that resulted in 50 professionals from all member states of the OECS being trained in Ebola management at Pedro Curie Institute in Havana, because the Cubans were on the front line of the Ebola fight. And a SWAT team of experienced Cuban medical professionals being made available to the OECS to assist in the event an outbreak occurred anywhere in the OECS. The PPS concurrently procured all of the protective personal equipment, the PPE, needed to safeguard our health professionals. Thankfully, Ebola never came to us. However, when the pandemic finally hit our shores in March 2020, our governments were not lost at sea because the essential mechanisms required for addressing that threat were already in place, and the avenues of close collaboration among the member states were already well established. At this meeting of the Council of Ministers, we will build on that foundation and focus on 4 key priorities. And these priorities, I must say, are also well aligned to the health to health as one of the term priorities set by our new chairman of the authority, the Honorable Dr. Terence Drew of St. Kitts and Nevis, for his tenure as chairman. We will be focusing on a more resolute fight against non-communicable diseases, and that conforms to what Sir Molwyn indicated. Secondly, we will be seeking to strengthen our preparation for disasters of all kinds and their deleterious impact on human health. And a number of our partners will be shaping this in closer collaboration with key partners such as CAFA, Disaster Relief, medical professionals on mission, who I must say is a proud Caribbean diaspora NGO that has been active in the region and internationally. PAHO, UNICEF, the World Pediatric Project, among others. And lastly, or fourthly, we will be sharing best practices and seeking to design stronger exchanges of capacity and experience across the OECS. Our experience over the eventful past 5 years has punctuated the importance of serious partnerships and helped us to clarify the guiding principles around these partnerships. An elemental principle is the importance of co-creation of initiatives that fulfill the mandate of all parties in ways that add value to each participant. We have seen a surge of agencies converging in our space, new Greeks bearing gifts. Our embrace of partnerships must go beyond the proverbial what's in it for me to what's in it for us. And more importantly, how do we collectively serve more effectively and deliver better, faster, and cheaper? We have great expectations of these meetings here in the BVI, and we look forward in great anticipation to their outcomes. I thank you.